Hello, I'm Dr. Denise Godin. Welcome back to AZH Wound Center in Milwaukee, Wisconsin for another edition of the Wound Care Window. Very interesting patient I'd like to share with you. This young lady is named Betty. Hello, Betty. How are you?
Okay.
Betty has agreed to appear in this video and tell us her story. I wanted to mention to all the young men out there that she is single, and if you feel so inclined, just send us an email and we'll provide you with maybe name and address. But for right now, we'll keep her sort of anonymous. And Betty, you came to me for a leg ulcer.
Yes.
I see here, and we've got a plan of attack. But when I first met you, you mentioned, hey, by the way, I've got this process here as well. How long have you been dealing with that?
I think I would say maybe a year.
About a year. And it has been drained in the past?
Oh, yes.
fact-
Every month.
Yeah. In fact, I drained it last week.
Yes, that's right.
That's come back pretty quickly.
Yes,
And
it
it's
does.
very tense here. Does it hurt you?
It doesn't hurt when you touch it. My arm just hurts because I think I have arthritis.
Okay. So what I wanted to do is show you that, again, as wound care providers, we need to be multi-talented and provide services to our patients, sometimes outside of the realm of wound care. This is a good example. I would hate to have her have to go to the emergency room or to go see her primary. She's here. We should be able to take care of that. We're going to do that. I am a little concerned about how quickly this came back for you. And we're actually going to ask some questions and see if there's some sort of sclerosing agent that we can put into that thing.
Okay.
It's obviously a cyst, and it is putting fluid into the cyst, as dead spaces do. And so let's see if we can somehow sclerose that tissue. I'm going to talk with the man that knows all about sclerosing agents, Dr.
Okay.
Siddiqui. We'll talk to him next visit and see if he's got some thoughts. You know, you could always think about putting some sort of pigtail catheter into this or some sort of drainage device, but then we get an indwelling foreign body, and that would potentially cause you an infection. I certainly don't want to do that.
Yeah.
So you ready to do this?
I'm ready.
All right. So the first thing we're going to do is we're just going to go ahead and do a little prep. So I already sort of know where I'm going to go because, like I said, I did this just about a week ago. We don't need to sterilize the entire area, but I am going to prep the area that we're going to be entering. All right, so we'll take a syringe. This is a Toomey syringe, 60cc syringe. We're probably going to need to empty this. She has actually a little bit more accumulation of fluid than the last time we did this. Now, sometimes this fluid is just clear. Sometimes it can be hemorrhagic. I suspect that this will be hemorrhagic.
Yes.
We're going to take this needle and we're going to pop it inside. One little stick here, Betty, sorry. And now I'm going to just go ahead and evacuate it.
Okie dokie.
It's actually fairly thick. The fluid is fairly thick, and you can see it is sort of sanguinous in nature. You can see it decompressing there. So we're going to make that cyst sort of do the Houdini act and disappear
Okay.
for you.
Okay.
That's very soft now. I'll try to drain as much as we can. A lot of times these things are loculated in the inside, so I'm moving my needle around just a little bit. Try to stay inside that space.
It doesn't hurt.
Now, Betty, I am going to need to change this out because we came to the end of our... Take this off. Just empty this syringe. You can see it's sort of gelatinous. It's sort of thick. The viscosity is fairly impressive, and we'll just reattach and try to draw some more off. There we go. Just about there, dear. And you can see I've collapsed that pretty well. And now we're at the end of our draw. Nothing else coming out. Just take a little sterile gauze. And out comes the needle.
Oh, that much
And we got
again, huh?
another 30. So that was 90. That's much more than it was last time.
Yes.
So again, we're going to see if we can get some sclerosing agent for you.
Okay.
So Betty, thank you so much for joining us on this edition of the Wound Care Window and sharing your story with us. We'll try to get this thing more definitively taken care of next time.
It's fine.
So again, thanks for joining us for this edition of the Wound Care Window. If anybody wants Betty's email or phone number, let us know.